Now, the second phase of the COVID-19 vaccination exercise is set to begin as the vaccines have been distributed across states. More than 4 million doses of the Moderna vaccine and more than 170,000 doses of the Johnson & Johnson vaccine is to be administered to people aged 18 years and above in the 36 states and the Federal Capital Territory. It is the government's plan to get more Nigerians vaccinated to achieve herd immunity against the disease. But a big challenge lies in the various perceptions about the vaccines and the attendant vaccine hesitancy among the population. Joining me via Zoom to talk about this perception is medical doctor and public affairs analyst, Dr. Thomas Wilson Ikubese. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
Right. Now that we are in the third wave and the issue of vaccine hesitancy did not just start with COVID-19. When you look at history, you also look at the issue of the polio vaccination, where some persons also refused to, take the vaccines. But when you look at education, how far have we gone with educating people on the benefits of taking this vaccine?
Well, I think we have gone far in educating people, but I think the main problem we have is in the counter-education from social media because of the several rumors that people have been carrying, which actually are not true. So many myths here and there that people are citing. Those are the things that we actually have as issues to contend with. But apart from that, the education so far is good. People are already aware of what to expect in terms of the vaccination, but so many rumors, people say it's going to change your DNA, they say it's going to be fertile. All of these are falsities that are not actually true, and that's the thing we actually have to contend with at the moment.
If you say they are aware, why is it being difficult for them to take responsibility for their health, especially seeing that the circumstances surrounding COVID-19 complication and the deaths, and the fact that a lot of persons are still bothered with the way government is handling these cases?
Well, one is the fact that people are always suspicious of government because of the way government has related with people over the years. So when government says that we have 1,000 cases of COVID-19 in a particular place, for instance, people doubt it until they see those who actually die from the situation. So I think it's that suspicion that is also being carried into the reservation that people have for COVID-19, because people don't tend to trust government in this part of the world because of the way the government has related with them also somehow. But the truth of the matter is COVID is real. People tend to downplay on it. If you go to most social function parties, you find people hardly use masks. People hardly maintain social distancing. Until they see someone that dies from it, they don't tend to believe it. And even in the vaccination, most people are beginning to run away from it, but thank God we're beginning to talk to them more and more. But most of the rumors they carry, for instance, they say it changes the DNA. It doesn't even penetrate the nucleus, talk less of changing the DNA. It doesn't contain microchips, it doesn't contain tracking devices. These are things that people hear that make them to become so worried and afraid of wanting to go for the vaccine. So I will lend my voice to our people, letting them know that it's not true that when you take the vaccine, DNA is changed, when you take the vaccine, become infertile. These are all falsehoods, which is not true. So we must necessarily go back to maintaining those things that we have always talked about: social distancing, washing of your hands, using of face masks, and the rest of them. If we continue to do that, I think we are in a better position to overcome the virus with time.
Perhaps we need to educate people on the efficacy of the vaccines, because you would see certain reports saying that some persons died despite being vaccinated.
Yes, at the moment, a lot of work is still ongoing with regards to the COVID-19 vaccine. And that's why when you take the vaccine, we still encourage you to put on face masks, to wash your hands, to maintain social distancing, because the vaccine, in as much as it stimulates your immune system to be able to produce immunity against the virus where it enters into your body. We still haven't gotten some very clear pictures about something. You know, for instance, someone has the first shot, it took the second shot, and still died of COVID. You know, so there's still a whole lot study that is still going on. But in any way, it's always better, it's still better for you to be vaccinated than to remain unvaccinated and keep running away from the vaccine because you feel it's better to stay unvaccinated. The vaccine still offers you some advantage against those who are not vaccinated. So I will appeal to our people, especially many of those who are running away from being vaccinated, that you stand greater risk of hospitalization, of death, if you are unvaccinated compared to if you are vaccinated and you come into contact with the vaccine. And the good thing is, even the manufacturers of the vaccine have told us that the fact that you are vaccinated does not necessarily mean that you will keep going unprotected and you will not obey or respect the COVID-19 protocol. So it gives you some kind of advantage against those who are not vaccinated. I think we should all go out and get shots of it.
A lot of persons is the mutation of the virus. Why they keep hearing the Delta variant being different from the previous variant, which is called the Alpha variant that we had initially. Perhaps you would want to educate people on why we are seeing this different mutation.
Yeah, it's in the nature of viruses to mutate, and that's why it's been kind of difficult to come up with a vaccine for HIV, for instance, because of the mutation that frequently goes on. But fortunately, that degree of mutation is not as pronounced in SARS-CoV-2 that causes COVID-19, unlike what we have in India. We tend to have mutations of the virus. It's the nature of viruses to mutate. But so far, so good. The other issue we are having, which are reservation, is the vaccine that we have at the moment. Are they going to take care of the mutations, the new mutants that we have? We have been told, yes, studies are going on. But like I said, in any case, it's better for you to be vaccinated because you never can tell which variant of the virus you will come into contact with. So in any case, with your vaccination, which has kind of triggered your immunity against coming down with the infection, you stand an advantage against someone who has not been vaccinated. So the mutation really is not a surprise to us in the medical world. It's the nature of viruses to mutate. But where you have a vaccine against it, you have an advantage against those who are not vaccinated.
There are also those who are asking that why aren't we focusing on telling people to also look at boosting their immunity and not just talking about vaccinations?
Absolutely, absolutely. You know, what the vaccine does is to boost your immunity. It basically causes your body to replicate the protein, the spike protein that you have on the SARS-CoV-2 virus, so that when it comes into contact with it in future, it's able to attack it and defeat it. So, but you can also boost your immunity naturally. Rest well, take a lot of fruit, take a lot of vegetables, eat balanced diet. These are all things you advocate from time to time. And that's why two people will suffer from the same infection, and one goes down, the other doesn't go down, because they have different degrees of immunity. So it's still very much in place that we need to eat right, take balanced diet, rest, take plenty of water, fruit, vegetables, and boost our immunity. It will help us not just against SARS-CoV-2, it will help us against all manners of infections.
Now, one last question before we let you go, Dr. Ekwubese. You mentioned earlier that why a lot of persons are not taking charge or being responsible for their health at this time is because of their suspicion towards government. Are you saying invariably that perhaps the government has not shown leadership that people can trust?
When we talk of leadership, it's not segmented. Leadership is all-encompassing. Look at what happened during the NSARS, that foodstuffs that were supposed to be made for the people were hidden, and people discovered and broke into those stores. So generally, our people do not trust government. They feel if the government is saying one thing, it's another thing. And thank God our leaders have had to take those vaccines themselves. Mr. President and the governors have to take them as examples. Before then, people were not even believing that it is real. So leadership is everything. Once leadership is jaundiced, the followership also becomes affected. So if our leaders show the right kind of leadership, it becomes easier for those who are behind to follow in everything that they do.
This morning. Thank you so much, medical doctor and public affairs analyst, Dr. Thomas Wilson Ikubese, for your time on the program.
Thanks for having me.